My name is Cheyenne Stevens, and I'm the Living Well Coordinator of Madison. Today I am here with Courtney Cowan with Northeast Planning Associates. Courtney, would you like to introduce yourself?
Yes, good morning, Cheyenne. Thank you so much for having me. So I am a life and health insurance producer from Northeast Planning Associates. My office is on Main Street in Madison, just 3 doors down from Rennie's. So I am someone that can assist folks that are looking for health insurance or life insurance, whether someone is getting ready to retire and they're looking for Medicare or something just as simple as a dental insurance policy. I can help folks with all sorts of different kinds of insurance.
How long have you been in this line of work?
So I first became licensed to do this in 2015. This will be my 6th season for open enrollment. And I also double as kind of the administrator for the financial side of the business.
Can you tell me a little bit about your services? Are they free? And if not, what types of payment do you offer?
Consultations are free of charge for anyone that has any questions about insurance. You can come on in, talk to me, we'll review your scenario. If you do decide to enroll in a plan through me as your agent, then I do receive compensation from the insurance carrier, very similar to how a car insurance agent works, or your home insurance. You talk to somebody, they run a couple of quotes for you through various carriers, and then those carriers go ahead and reimburse you for your production.
So what you're saying is that your clients are not paying you directly out of pocket. They're paying you through their insurance.
Correct. And even still, there are very strict guidelines when it comes to the insurance industry. So CMS, the Centers for Medicare and Medicaid Services, very clearly stipulates that no one carrier can compensate an agent higher than another. So I don't give any biased recommendations.
Can you tell me a little bit about the quotes?
Certainly. So again, when it comes to health insurance, there are different types. There's Medicare insurance. I'm an expert in Medicare, but I can also help with individual health insurance, insurance that you would purchase through the marketplace, that's more popularly known as Obamacare, and dental insurance, vision, eyeglasses, things of that nature. Right now it's pretty important because with COVID-19, we've seen a lot of our community members unfortunately lose their employment. And along with that, their employer insurance has gone away. So that qualifies them for a special enrollment period to enroll mid-year into, their own insurance policy that they would carry after the employer insurance ends. And then, of course, we always have people that are turning 65 or are retiring and are eligible for Medicare. So when it comes to Medicare insurance, there are a lot of moving pieces, and I am here to help everyone put those pieces of the puzzle together to pick a plan that works best for them.
How long do you typically work with a client at a time?
It really will depend upon the individual. I take a look at that person on paper. I ask them to tell me who are the doctors that they visit, what prescriptions do they take, and then I take all of that data and I run it against the various insurance carriers to find out, well, perhaps this medication is a tier 1 with this carrier and it's a tier 2 here. So I'm able to take a look at even people that currently have insurance. There are enrollment periods that allow them to make changes to that coverage, and I can certainly help them with that as well if they have questions about their current coverage.
Thank you. What precautions are you doing right now with COVID-19?
So we are fortunate enough to have a very large conference room where we can pretty much stay clear across the room from each other. And right now, due to COVID, we are seeing clients by appointment only. So that reduces foot traffic. Of course, we're cleaning in between every appointment, and we are asking our clients to kind of come in with face covering. And then once we situate ourselves, if we're far enough away and comfortable, we can kind of take those down so that we can have a conversation.
Well, it's good that you're taking those precautions.
Certainly.
Due to COVID-19, have you noticed that you have had an increase in clients?
I have certainly, the phone has started ringing a bit more, just for people to ask, now wait a minute, I'm not clear on whether or not I qualify to apply for this insurance or not. So what I would point out to folks is that there are various enrollment periods for different types of insurances. For Medicare, every year between October 15th and December 7th, there's an open window where you get to go shopping again. You get to look at the plans for the upcoming year and make any changes that might be appropriate for you. Similarly, with Marketplace, or Obamacare as it's sometimes called, they also have an open enrollment period. That one starts November 1st, runs through December 15th, and it's a great opportunity to take a look at, okay, this is the upcoming 2021s coming up. This is the plan I have now. Have they offered a new plan that I might want to look at? So I can help folks navigate all of those different questions that they have.
Can you give me some examples of how your services directly impact the people that you are helping?
Yeah, for sure. I mean, again, in this tumultuous time of COVID-19 and the new normal, people they're losing employment. They don't know where to go to find other outlets for this insurance. And you definitely don't want to have coverage at this time with this pandemic going on. So certainly it's impactful in many different ways. But I think, again, when I meet with that woman who maybe has had an insurance plan in place for a long time, has never reviewed it, didn't know there were other options out there, they're really pleased when they can leave my office and know that they've had a thorough review of the coverage and they were able to make a switch that works a little bit better for them.
Do you work with people of all ages?
Absolutely, all ages. And again, when we talk about insurance being not one size fits all, that's my biggest message. Medicare insurance, health insurance, it's not one size fits all. So when I sit down with a husband and wife, husband could need a completely different type of plan than wife does. And I think sometimes people get caught up in the processes and they kind of lose, the understanding that, well, this may be better for me as an individual, and then, my cousin, my uncle, my brother might have this type of insurance, but it's not exactly right for me. So it's always good to explore all of the different types of policies that are out there.
And that's what you specialize in.
Precisely.
So you work as more of an informant, so you make sure that whoever comes to see you, they get what's best for them with no biasment.
Precisely. So again, I can, if someone comes to me with a particular carrier in mind, I work with all of the various insurance carriers, whether that's Martin's Point, United Healthcare, Anthem, you name it. I'm an independent agent that has access to all of the various plans and features that they offer.
Any other points that you'd like to highlight?
I do think that it's important for people to use the open enrollment period. It's a really great time to just take a step back, make sure that you've got all your ducks in a row for the upcoming plan year. So definitely come mid-October if anyone in Somerset County, or really I work with folks all over the state of Maine, but folks can reach out to me to provide me with a snapshot of themselves, again, by giving me the names of the medications they take, the providers that they see, and I'm more than happy to do a quick benefit comparison and see if there's an alternative that they could consider. Another item that I have available as a resource to folks is that I do conduct Medicare 101 classes at 3 local adult education departments. So in the fall and in the spring, I conduct 2 to 3 classes each at the Skowhegan High School, at Lawrence Adult Education in Fairfield, and at the Waterville High School. So people can watch my website for those dates and with the links to register. But again, Medicare 101, it's about a 90-minute course that I put on, and it kind of just brings you through the basics of Medicare and why you would want additional insurance to go along with it.
With COVID-19, do you think that there will be a Zoom option available for the upcoming ones?
We are exploring both the Zoom meetings, and I have reached out to see about a potential of social distancing on a soccer field. So I kind of thought that might be a nice way. People aren't going to be able to go see their children and grandchildren at the sporting events this fall. They've called that off. So I might be having a Medicare 101 near you. You can bring your lawn chair and socially distance and watch the show.
Well, I think that what you do is excellent work, and I think that you are a great resource for the town of Madison and all the towns around us. What would be the best way to contact you?
Certainly. So folks are always welcome to stop in. Again, I'm on Main Street in Madison, 3 doors down from Rennie's, 59 Main Street. You can reach me at 207-696-0914 or on my website, which is simply Courtney Cowan, COWAN.com. Got a big Contact Us button up in the right-hand side of the corner, and I would love to work with anyone who has any questions about insurance. I really like to take an educational approach to that.
Well, thank you, Courtney.
Thank you.